Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
An 82-year-old man with a long history of depression has been treated over the years with various pharmacologic agents with little improvement. Last week, the psychiatric mental health nurse practitioner decided to try vortioxetine as the patient is clearly despondent and has not responded to several SSRI options and is not interested in discussing electroconvulsive therapy. At this visit, the patient appears markedly brighter. He engages in conversation, he has been more active with his peers at the assisted living facility, and overall he seems much improved. He has no adverse effects and actually reports improved bowel motility, which is, of course, a real plus for any of us, but especially our older adult population. So, the psychiatric mental health nurse practitioner considers that. Do you consider that A, the SSRI SPARI combination has improved the patient in a way that the SSRI alone did not? Or do you consider B, the patient may be planning suicide and a suicide screening should be implemented? Or C, it's likely a placebo effect from the new medication as it's unlikely therapeutic after just 1 week? Or do you consider D, it may actually be an impending manic episode that had not been diagnosed previously? Okay, so you have this 82-year-old man, long history of depression, lots of meds, no improvement, and last week you prescribed an SSRI SPARI combo. That's a selective serotonin reuptake inhibitor / selective partial agonist. And that would be, like a BoostPAR analog type of drug. Anyway, vortioxetine, Trintellix, and Vibrid are the two SSRI SPARI combinations on the market. And they combine selective serotonin reuptake inhibitors with serotonin partial agonist. And there is, ostensibly some benefit to combining both of those together. So you tried it for this patient, and a week later, he is brighter. He is improved. Overall seems much improved. No adverse effects. And as a side note, his bowel motility is improved, probably because of the serotonin partial agonist feature. So, what do you attribute that to? As you look at these answer choices, B is the correct answer. The patient may be planning suicide and a suicide screening should be implemented. Remember, number one, men over the age of 75 are the highest demographic for completed suicide, statistically higher than any other demographic. So there's that. Just from demographics alone, he is at high risk. Also, it's not unusual that once someone makes the decision to end his life, there is a sense of relief and calm, and the patient may actually set about contacting friends, family, basically wrap up life with some peace of mind. It's like it's a relief to come to that decision to end his life. It's not likely that any medication is going to produce such an improvement after 1 week, especially when he has been on multiple agents in the past with no improvement at all. Could it happen? I don't know. I guess there's nothing new under the sun. I guess anything could happen, but it is really unlikely given his non-responsive history, the state of mind last week, the fact that it's only been 1 week, and the depth of his improvement at this point. Is A possible? I guess, but not very likely at all. It is classic in older adults that when they are planning their death, there's almost a sense of relief there. It's like a weight off their mind and they brighten up a little bit, start setting things right, reaching out to people they haven't reached out to, putting their things in order. It's because there's a sense of relief that they're not going to have to deal with this anymore. C says it is likely a placebo effect from a new medication. This is not likely either. Again, given his history of non-responsiveness. Now, if it were a different kind of patient, they'd never been on any med in the past, and you put them on this medicine, there might be a placebo effect early on. But for this patient with his history, really very unlikely. And, similarly, sometimes when you have a patient with bipolar depression that's undiagnosed as bipolar disorder and you give them an antidepressant, it actually precipitates a manic episode, but really unlikely here. Again, he's 82, he's been on multiple pharmacologic agents in the past, and reportedly, there's no documentation here about any precipitating manic episodes, so it's very unlikely that it's happening today. In different circumstances with different patients, maybe. And that's not to say that any one of these couldn't be true, but remember, just like clinical practice, when you evaluate a question on your boards, it's usually not a case that one answer is right and the other three are wrong. It's usually a circumstance where all of the answer choices could work, but you have to pick the best answer to the scenario. You have to pick the one that's most likely here. And here, with this patient, with this history, and this demographic, B is the best answer of those provided. It is very possible that he has decided to end his life, and that's why he feels better. And from a safety perspective, a suicide screening, it just has to be done. It takes, very little time and effort. It's not invasive, and it could yield some important information. So could A, C, and D be it? Could be, but in this case, B is the best answer to this question.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.